Welcome to Lifeline News Hour. A shocking report reveals that approximately 1 in 100 persons in India might be infected with hepatitis C virus. It is estimated that 288,000 new HSV infections occurred in India in 2014 alone. In India, HSV-related deaths are estimated to be as high as 96,000 every year. Here is a report.
I have Dr. Vijay with me to tell us more about the disease. Welcome to the program Lifeline, Doctor.
Thank you for calling me for this program.
Doctor, our audience are eager to know more about hepatitis C virus and how it affects us. What is hepatitis?
Well, hepatitis refers to inflammation in the liver. Inflammation is a process by which the body's white blood cells and substances they produce help us to fight against bacteria and viruses. Inflammation can also damage our own liver cells.
Okay, Doctor, can you please tell us about the liver? Where it is situated in our body and what are the functions of the liver?
Oh sure, I will explain. Take a look at this animated video on the screen. Liver is located under your rib cage on the right side of the body. Liver is a vital organ that processes nutrients, filters the blood and fights infections. When the liver is inflamed or damaged, its functions will be affected.
Okay, can you please tell us more about hepatitis C?
Yes, hepatitis C is a virus called HCV in short. HCV can infect liver. Acute hepatitis C refers to the first 6 months after someone is infected.
Approximately 25% of the patients with acute HCV fully recover during this time. Acute infection can range in severity from a very mild illness with a few or no symptoms to a serious condition requiring hospitalization.
Oh, Doctor, what happens to those approximately 75% of patients who do not recover?
About 75% of the acute HCV develop long-term or chronic HCV unless successfully treated with medications.
Okay.
Chronic HCV can lead to cirrhosis or severe scarring of the liver, liver cancer and liver failure.
Oh my God.
With the availability of newer oral drugs, cure rates have increased to more than 95% in most of the cases.
Oh, who is at risk of having hepatitis C, Doctor?
I'll give you some examples to explain who are at risk of being infected with hepatitis C. These patients are treated and are now out of danger and have fully recovered to lead a normal life. Rakesh, a young and energetic boy of 18 years, had engraved his favorite tattoo design on his arm during his holidays a couple of months back. We suspect that this is where he must have gotten infected with HCV. Sanjeev, a bank employee in his early 40s, had met with an accident during his early 20s and was infused with blood in the year 1995 when the blood was not being screened for HCV before infusion. The virus must have entered his body through the blood transfused following the accident. Harjeet, an active farmer, has been taking shave from a local barber on the roadside for several years. He was found to be infected with hepatitis C since he was infected with the virus. It's clear that he was infected from the unsterilized razor or the blade the barber used. Rakesh, Sanjeev and Harjeet are today living a normal life thanks to the timely diagnosis and the treatment they received. So, as you saw in the film, a person can get hepatitis C when a blood from an infected person enters into his or her body, and this can happen if the person shares the drug needles with an infected person, got tattooed or pierced with unsterilized tools that were used on an infected person, received blood transfusion before 2001 when blood was not routinely tested for hepatitis C, is born to a mother who has hepatitis C, there is a 6% chance of getting transmitted from mother to the child.
Alright. What are the common symptoms of hepatitis C infection?
Good. This is a very important question. Only 15 to 30% of patients infected with the virus present with the symptoms. Symptoms appear within 5 to 12 weeks of the HCV exposure and last 2 to 12 weeks.
Oh.
This may include fever, fatigue, feeling tired all the time, headache, depression, mood swings, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movement, joint and muscle aches and pain, jaundice or yellow color in the skin or eyes.
Oh, doctor, what are the long-term effects of hepatitis C?
Of every 100 people infected with the hepatitis C virus, about 75 to 85 people will develop chronic hepatitis C virus infection. Of those, 60 to 70 people will go on to develop chronic liver disease. 5 to 20 people will go on to develop cirrhosis over a period of 20 to 30 years.
Oh,
Cirrhosis is the severe scarring of the liver and the poor liver function seen at the terminal stages of chronic liver disease.
oh. Doctor, how can hepatitis C transmission be prevented?
There is no vaccine to prevent hepatitis C. Vaccine research in the area has been ongoing for several years. It's advisable not to share needles. This could be any needle, whether it's for injecting, cosmetic substances, drugs, steroids, or something else. You should also avoid sharing needles used to inject medications such as insulin for diabetes.
All right.
Also, needles should not be reused for vaccination programs. This is how hepatitis C and other bloodborne viruses have been spread in the past in some countries.
Okay.
Ideally, you should not share personal items and should not use items that may have come into contact with an infected person's blood. Example, razors, nail clippers, toothbrushes, etc.
You're right.
If you plan to getting a tattoo or having a body piercing, then it is important to ensure that the facility is licensed and that they use new needles and sterilize equipment. It's also advisable they use new ink and new ink pots.
Oh, how would a person know if he or she has hepatitis C infection, doctor?
The only way to know if a person has hepatitis C infection is to get tested. Two types of tests are commonly used to detect hepatitis C infection. Test that checks the blood for antibodies. Antibodies are proteins made by the immune system in response to the virus. This is preliminary test. If this test is positive, then patient has to undergo a confirmatory test.
Okay.
2. Confirmatory test checks for substance called RNA made by virus itself. Most people who have negative antibody test do not have hepatitis C infection and do not need additional testing.
All right.
Hepatitis C infection is curable, and if one takes medication properly, they can save themselves from the disease and its consequences.
Okay.
Well, I hope I have answered all your questions.
Yes, doctor.
Any more queries or apprehensions?
That's all for now. Thank you, doctor.
Well, friends, by now you must have understood what hepatitis C is and what problems it can cause and how one can protect themselves from HCV. Come, let's pledge to be careful to keep hepatitis at bay. Live healthy, live happy, and have a great day.